Hey, what's up you guys? Welcome back. As you can see, I'm obviously in a different location today. I'm actually at my place of work. So I thought I'd make my next video what athletic therapy is, because the month of June is actually Athletic Therapy Awareness Month, so I thought this was the perfect time to make this video and just let you guys know exactly what it is. So let's get into it. So first things first, athletic therapy is very commonly compared to physiotherapy, and there is a reason for that. It is quite similar, although our education was a little bit different. There's a few differences with it, so I'll get into that a little bit later. So athletic therapists are actually trained in musculoskeletal disorders and injuries. Our name unfortunately makes it seem like we only treat with athletes because it's athletic therapy. We do specialize in athletes, however, athletic therapy is for everyone. I can't emphasize that enough, it's for everyone. We treat motor vehicle accidents, we treat pre and post operations, we go into life accidents. Obviously we train athletic injuries, we also help with prevention. You know, we go into workplace accidents. I feel like I'm missing some. Literally, if you can, get the idea here, there's a long list of people that we specialize in treating for sure. So one of the biggest questions that I get for sure is, if I'm not an athlete, can I come see an athletic therapist? The question is 100% yes, you can. As I mentioned before, we literally treat everyone, so please keep that in mind. And even if you don't have an injury, we help with prevention, as I mentioned before, so doing exercises and mobility and rehab to help prevent you from getting injuries either in your workplace, your sport, or just in life. So there's one of two places that you're actually going to find us. Actually, there's probably more, but I'm just going to mention the two top ones. We work either clinical or field. So clinical is like the physiotherapy side. Actually, the field's like physiotherapy as well because they're also on the field. But in the clinic, we do exercise rehab within a gym similar to this. But we also work into manual techniques and working into scar tissue and those kind of situations as well, so we do a lot of hands-on technique as well. But we are also trained in modalities, so if any of you have seen a physiotherapist before, you may have been attached to one of those machines with the little buzz pads on it. We can also do that, we're also trained in that. Those are called modalities, so there's anything from IFC, NEMS, TENS, ultrasound. This may sound like a bunch of gibberish to you if you don't know what I'm talking about, but rest assured it's something called modalities, and they're little machines that will help us treat pain and scar tissue and all sorts of things. Now, I also mentioned field. This is where the sports start to come in the athletic side of things. So field means working with a sports team. So either soccer, hockey, baseball, basketball, lacrosse, all of it. We literally work with all the different teams. When we're doing field work, this is actually more the emergency care side of our job. So we will be doing essentially the same kind of thing as paramedic. So if something or someone ended up getting hurt on the field, we are the ones that go in and help. We are not paramedics. We're actually trained as first responders. So when something happens onto the field, we decide if we need to call the paramedics. So that's what I mean by it, like paramedics. So if something was to happen on the field, or if someone on the field was to hurt themselves while playing their sport, we are the first of care. We go out onto the field, assess and decide if they can continue playing or if they need to be taken off the field and to be assessed off the sideline, essentially. And then decide if they can then go back into play. And if they can't go back into play, we pull them And this is essentially to the best of our knowledge and the best thing for the athletes, even though we tend to get a lot of hate from athletes for bowling them from the field, but be assured this is for your own good. But yeah, afterwards, once we find out that you've injured yourself or if you've broken a bone, something has happened on the field, that is when we can start going into the clinical side of things, which I mentioned before. So we would start your rehab program to get you back to play. Now the next thing you're probably thinking to yourself is, what on earth is the difference between an athletic therapist and a physiotherapist? This is a question that I am frequently asked on a regular basis. And it's a very fair question, and the answer is pretty much it's our schooling. That is the biggest difference, which seems like an obvious, but I'm going to get further into this. We are both trained in musculoskeletal rehabilitation and assessment, but we do have our differences. Athletic therapists are solely trained in musculoskeletal injuries. Meanwhile, physiotherapists are actually trained in neurological, cardiovascular, along with musculoskeletal injuries. And they can also be found in hospitals and outpatient clinics. So both professions will complete an assessment. They'll go into education of your particular injury. Then we'll go into manual therapy techniques, and then right after that is typically when we will always send you off with a home program doing therapeutic exercises. We both treat acute and chronic injuries while maintaining a professional standard of care. Now typically you do not need a doctor's referral to see either an athletic therapist or a physiotherapist, but you should always check with your extended health coverage just to see if you are covered for either of the professions. But also just check with your family doctor if it is something that is right for you. But just be assured that you do not need a doctor's referral to come and see us for treatment. Now here in BC, you definitely do not need a doctor's note to come and see a physiotherapist or an athletic therapist, as I mentioned, but I'm just going to say this just in case people from all over the world are watching this. If you're going to go see a physiotherapist or an athletic therapist and you're not in Canada or not in British Columbia in particular in Canada, just be sure that you check with your government's healthcare rules around if you need a doctor's referral. Also check with your extended health coverage to see if they also require you to have a doctor's note or not, because everywhere's different. Now both professions do have shared knowledge and skills in both our lines of work, one of which being assessment. So we do assess injuries, and we're technically not allowed to diagnose things, but we will find out what it is, and then maybe run it through with your family doctor. We'll probably run it through with your family doctor and just make sure that they diagnose it. Both professions have shared treatment approaches, such as doing hands-on soft tissue and joint manipulations. We'll also go into preventative taping, so that's like that kinesiology taping or pre and post taping for sport events or just life events in particular. We also go into what I mentioned before, which is the modality machines. So doing the NEMS, TENS, IFC, ultrasounds. The biggest difference between the modalities with the two professions though is physiotherapists are allowed to pierce the skin. So that means that they can do things like dry needling or IMS, so intramuscular stimulation is what it's called. And they can also do acupuncture as well. Not like the traditional Chinese acupuncture, that's obviously different unless they've had the training in it. But those are the biggest differences between us with modalities in particular. Now the next thing that we'll do with treatment is start going into exercise techniques, which I have mentioned many times before. So the biggest thing with any kind of treatment is you definitely need your own home program to maintain what it is that we do with you here in the clinic. So doing things like strength, mobility, flexibility, going into biomechanics is another thing that we will assess and treat. Make sure that you have the correct biomechanical movements for each of your joints. because that is very important, and throughout life we tend to pick up let's just say, little mannerisms that aren't exactly the way that we should be. So for instance, if you watch a child actually walk around and squat down to pick something up, their squat is impeccable. It is so good. It is the exact way that every single human being is supposed to be squatting. Thing is just as we start to get older, we just start to pick up other habits that seem to be easier for the human body, but in the long term, it's actually going to cause a lot of problems and injuries. So something in particular that everyone can relate to is posture. Posture is a big one that I check every single patient of mine when I first meet them, but it's also something that I look at with every single patient when they're walking into the treatment. Is I watch their gait and I watch how their posture is. So the thing with posture is people will start to slouch forward and do this position, and it's typically because we're sitting there on our phones doing this, or we're in front of a computer all day working. Fair enough, you get tired by the end of the day, but that's why we always need to take frequent breaks. So that's just one example. I could go into this forever, but that's just one example of mannerisms that we pick up and biomechanical situations that we would like to correct and will correct with you when you come into the clinic. And then the last thing that we always go through with every single patient, both physiotherapy and athletic therapy, is patient education, which, as in that last little blip that I was just talking about, that's part of the education part of it, depending if that is your situation in particular. But yeah, we'll go through education just so that you understand why you have to do what it is that we are doing, and why the exercises that you're doing at home are so very important for your rehab and to stop your pain. Now, the next big difference between athletic therapy and physiotherapy is our scope of practice. I'm going to actually read off what the scope of practice are on each of the college. But I have written up a big blurb on the biggest difference between athletic therapy and physiotherapy over at my blog, which is loselife.com. I'll put it on the screen on here somewhere. But yeah, I'm gonna read this out just so I don't get it incorrect and say things wrong, because of course I don't want to start a battle between athletic therapy and physiotherapy. We work together as a great group of people in the clinic, and we always bounce ideas off of each other too, so we get along. We definitely get along. But I just want to be very clear with this video on what the difference is between physiotherapy and athletic therapy, just so that we don't get compared all the time. Now, the definition of athletic therapy straight off of the Canadian Athletic Therapy Association's website goes as follows. Certified athletic therapists are best known for their quick thinking on-field emergency care of professional and elite athletes. The first to respond when someone gets hurt, they are experts at injury assessment and rehabilitation. It's that same mix of on-site care and active rehabilitation skills that makes athletic therapists so effective in treating the musculoskeletal, which is bones, ligaments, muscle, joints. Their injuries of all Canadians, whether on the field or in the clinic. As I mentioned before, we work both field and clinic. Athletic therapists adhere to the sports medicine model of care. They treat a wide range of patients, from kids with concussions to seniors recovering from hip replacement surgery, using various manual therapy techniques, modalities, exercise prescription, and even bracing and taping. The treatment varies, but the objective doesn't. An athletic therapist's goal is to help clients return to their usual activities, whether that means playing competitive sports or walking to the mailbox and back. So as I mentioned before, athletic therapist treats everyone, not just athletes, as the definition says there. But yeah, let's get on to the definition of physiotherapy. Okay, so the definition of a physiotherapist right off of the Canadian Physiotherapy Association goes as follows. The heart of the physiotherapy profession is understanding how and why movement and function take place. Physiotherapists are highly skilled and autonomous health professionals who provide safe, quality, client-centered physiotherapy through a commitment to service, availability, accessibility, and excellence. The profession is shaped by scientific evidence and the education and competencies of the physiotherapists delivering the services. Physiotherapy is grounded in the belief that to be effective, its services must respond to the changing needs of populations and our health systems. So that's physiotherapy, the definition of it. I'm going to link all of the links below and websites of my blog, the different associations websites if you want to look further into them. But I'm also going to link the links of where to find these particular scope of practice of each profession if you want to look further into that. Next, I'm going to go into how to become an athletic therapist. So if you are interested in becoming one, this is how it's done. So we are trained through a 4-year Bachelor's of Applied Health Sciences degree in athletic therapy. That's here in Canada and all across Canada. There's a bunch of different schools. Again, I have actually written a blog post on how to become an athletic therapist, so if you want to learn a little bit more about it, please head over to my blog, loselife.com, just so that you can find out more about that. So first off, you can actually go into athletic therapy school straight out of high school. That's personally what I did. I went to Sheridan College in Brampton, Ontario. I personally think it's one of the best schools here in Canada, but I also haven't experienced any of the other schools, so I'm gonna say they are all fantastic. So whichever one you decide to choose to be a part of, you've made a great decision. Now, just like any university or college degree or diploma, there are certain classes in high school that you do have to complete before you go into applying to get into the different universities for athletic therapy. I only remember some of them. Like I said, I wrote this all down on my blog, but the ones in particular that I can remember that I had to take was biology and a math of some sort. You definitely have to have English. I don't remember if you have to have chemistry or not, but like I said, I wrote this all down on the blog, so you can head on over there to check out the actual specifics, or again, I will link down below Sheridan's website so that you can look to see exactly what the prerequisites are for the program. Once you get into athletic therapy, congratulations, you made it. From here, your first year of school is going to be your basic sciences, so going through biology, psychology, physiology, biomechanics, really cool classes, but all the basics that you need to continue the other 4 years of schooling. The next years, 2 to 4, are hard work, I'm not gonna lie, but very much worth it. So ideas of classes that you'll be taking from year 2 to 4 is things like anatomy, physiology, exercise sciences, going into rehabilitation, clinical, treatment and care, going into emergency, that's another one too, so you start to learn your emergency care, that's in second year. There's just like a huge wide range of classes that you start to do, and it is so fun. From years 2 to 4 is when I really started to engage in the program. But like I said, that first year is really necessary. You do have to do it. But yeah, it's so much fun. I really enjoyed school. So the classes that you're going to be taking throughout your 4 years of school is both lecture and lab. Lecture is where you're going to be learning all the particular information that you need to know in that class. And then the lab is where you start to be able to put all the hands-on technique together and start learning how to do things in person. I personally really liked labs. The lectures are very important though, so that's where you learn like the majority of the information that you really need to know about, but I learned best by practically doing it. So as I mentioned, the schooling it's difficult, it's challenging. Do keep that in mind for the program. Not trying to scare you away from it. It's just a lot of hard work. So just know that going into the program, you do have to put some work in. I definitely learned that very quickly when I got into the program. But honestly, once I started putting that hard work in, it became fun. The school was just, I learned so much, and I really enjoyed it. So if it's something that you're thinking about, definitely consider it for sure. Now, once you finish your 4 years of education at your college or university, you do have to do a national certification exam. Now, when I was doing the exam, we had both a written and a practical. They have since changed it and made it into just a written. So from what I understand, I think it's a 200 multiple choice question written exam. It's the same format and idea that they do down in the States with the NATA, so the National Athletic Therapy Association. But yeah, I'm kind of crushed that you guys didn't have to do the practical like I did, because I'm telling you, I was sweating by the end of it. I was sweating. But yes, that's the national exam. So as I said, you don't have to do the practical anymore, but you do have to do a written exam. You have to pass that exam to be able to work legally here in Canada as a certified athletic therapist. And then once you finish your exam and you pass it, you did it! Yay! You're a certified athletic therapist! You made it! Whoop whoop! Where's the proof? Where's the proof? I can't even tell you how excited I was to A, graduate, and B, become certified. It was such a long haul of schooling, but like I said, totally worth it. But yeah, now you're certified. Now you can go and work in the field or clinical setting, as I mentioned before. And another important thing to mention is there is a difference between Canadian and American athletic therapy. So here in Canada, we are referred to as Canadian athletic therapists. Therapists, that's the biggest difference, and we run under the Canadian Athletic Therapy Association. Down in the States, they run under the National Athletic Therapy Association, so the NATA, and they are referred as athletic trainers. So that is the biggest difference between the two countries. Essentially the exact same profession though. That is it for this video. I really hope you enjoyed it, learning how I became an athletic therapist and how everyone else here in Canada became an athletic therapist, and the difference between what athletic therapy and physiotherapy is. As I mentioned, I have a more detailed write-up on my blog at loselife.com, and up on my Instagram as well, so I'll attach the Instagram here as well. But yeah, if you did like this video, please, please, please like, comment, and subscribe to the channel. More for this video in particular. Here in Canada, we're still trying to get athletic therapy to become a regulated profession like physiotherapy is. We're still a small college, so the more likes and information and shares of this video may help us become more regulated and noticed here in Canada. So I'd really appreciate that. But I really hope that you have the best day. Thank you very much for watching until the end, and I'll see you next time. Bye guys!